Hi, my name is Kevin Chavez and I'm going to talk about Acanthamoeba keratitis. Definition. Amoebic keratitis is the most common clinical manifestation of infestation by the genus Acanthamoeba. It is characterized by being painful and dissembling. The infection progresses to ulcerations of the cornea and may result in blindness in very serious cases. It is a difficult disease to diagnose and treat since clinical manifestations are often confused with those of herpetic, fungal keratitis, or mycobacterial, which causes the correct diagnosis and initiation of treatment weeks or months are delayed. Medicine. It is characterized by being very painful and dissembling. It is usually progressive, unilateral, and affects both sexes equally. From the symptomatic point of view, it usually presents with severe eye pain, redness in the front part of the eye, tearing, photophobia, decreased visual acuity, and a foreign body sensation. There are a wide variety of techniques for obtaining samples and subsequent diagnosis of acanthamoeba keratitis. The main one being corneal scraping. This diagnosis of amoebic keratitis is confirmed by examination of corneal scrape material stained with giemsa or tricorium and with culture or special media. Pros and cons. The clinical picture varies depending on the time of the first consultation. At first, amoeba are found in the corneal epithelium, but if the disease progress, invasion of the stromal course, initially it is characterized by limited punctate keratopathy, epithelial, subepithelial, or perineural infiltrates, radial keratoneuritis. At this time, the patient present redness, tearing, photophobia, and pain of varying intensity. If this disease progresses, ulceration, annular infiltrates, endothelial plaques, and anterior uveitis may be seen, with or without a papillon. Presence of pus in the anterior chamber of the eye, and less commonly corneal edema. If the process worsens, abscess, scleritis, glaucoma, cataract, and secondary microbial infection can be occurred.
A lot of studies have now been done looking at risk factors using the best sort of statistical method, so we know that these are kosher risk factors which are actually being tried and tested. And we've shown that swimming in contact lenses and showering in contact lenses increase the risk several fold of getting acanthamoeba infection. This is because of the risk of contaminated water, which is higher in swimming pools and higher in domestic tank stored water, which is where the water supply comes from in most but not in all houses. Irregular contact lens disinfection, not doing it every day appropriately, not following the instructions has been shown to be associated with an increased risk, and not washing and drying your hands before you handle your contact lenses and do the disinfection. So it's really important to dry those hands, and that will reduce the numbers of organisms there. Things to remember is that this is a largely avoidable disease for contact lens wearers, and if we can educate patients to avoid water whilst using your lenses, don't do anything in your contact lenses you would do with your glasses on. You're not going to stand in the shower with your spectacles on, you're not going to wash your face with your spectacles on, and you've got to dry your hands after washing them before handling your lenses and doing a contact lens.
Issue applied in Ecuador. The low prevalence of cases of keratitis due to Acanthamoeba spp. It is probably because this amoeba is underestimated as an etiological agent of this pathology, which leads to an erroneous and late diagnosis with an unfavorable evolution for visual health of the patient, being therefore a challenge for the ophthalmologists and for the laboratories correct diagnosis and treatment, where the suspicion of out should be higher when having a population of contact lens wearing patients with high popularity of use, either for therapeutic or simple aesthetic, and where the good habits of contact lens hygiene, your conservation, and their case are not complied with fullness. In conclusion, the great ubiquity of Acanthamoeba spp and therefore the high exposure of the population to contact with this protozoan led to a high percentage of the population with antibodies against this parasite. However, there are cases of amoebic keratitis in immunocompetent individuals associated with the misuse of contact lenses. Of the risk factors responsible for the increase in the incidence of amoebic keratitis, it is worth highlighting the increase in the use of contact lenses. In order to obtain a good prognosis and resolution of the disease, it is vitally important to carry out a thorough analysis of the patient that allows the identification of risk factors and to be able to carry out a correct diagnosis and early treatment. Thank you.